Greetings everyone, I'm Dr. Ketan, fifth year Neurosurgery resident at Bangalore, and today I'll be discussing about carotid artery stenting. Carotid artery stenting is an endovascular revascularization procedure used to treat significant carotid artery stenosis, a major cause of ischemic stroke. Most stenotic lesions occur at carotid bifurcation, typically involving the proximal internal carotid artery. These lesions are usually caused by atherosclerotic plaque, which can lead to thromboembolism and cerebral ischemia. Traditionally, the gold standard treatment for symptomatic carotid stenosis has been carotid endarterectomy. However, carotid artery stenting has emerged as a minimally invasive procedure, particularly in patients who are high surgical risk. This procedure is performed in an angiographic suite under fluoroscopic guidance. Access is typically obtained through a common femoral artery puncture. A guiding catheter or a sheath is navigated into the common carotid artery, and a diagnostic angiography is performed to assess the severity and the morphology of stenosis. One of the critical steps in carotid stenting is cerebral embolic protection. Most operators deploy a distal embolic protection device, which is essentially a small filter placed in the internal carotid artery distal to the lesion. This device captures plaque debris that may dislodge during the procedure and prevents distal cerebral embolization. After the protection is established, balloon angioplasty is usually performed to pre-dilate the stenotic segment. A self-expanding carotid stent is then deployed across the atherosclerotic plaque, restoring the luminal diameter and improving cerebral perfusion. In many cases, post-dilation balloon angioplasty is performed to optimize stent expansion. Patient selection typically includes symptomatic carotid stenosis greater than 50 to 70% or asymptomatic stenosis greater than 70%, depending on patient risk factor and anatomic consideration. Large randomized trials such as CREST trial have demonstrated comparable long-term outcomes between carotid stenting and carotid endarterectomy in selected patients. However, careful patient selection remains essential because the risk of periprocedural stroke is slightly higher with stenting, while the myocardial infarction is more common with surgery. Today, carotid artery stenting is an important component of modern stroke prevention strategies, particularly in high risk surgical patients and anatomically challenging lesions.